Hi everyone, Una of Little O Nutrition here, just with a little nutrition bite. So something that I've been reading up a lot on lately is health policy. So as you know, I've just moved back to Ireland from the UK, so I'm making sure that my policy knowledge is up to date. And something that I've been reading obviously a lot about is Healthy Ireland. I'm sure if you live in Ireland, you've definitely heard about this because it's everywhere at the moment, which is great. And there's lots of great work going on around Healthy Ireland. But in the policy document, there is all these references to reducing weight stigma, particularly for children in large bodies, that they are, rescued from teasing and rescued from kind of the damaging effects of weight stigma, which if you want to read more about, I'll post my blog about weight stigma below. And I think that's really, really important because we have so much data telling us that weight stigma is really bad for health. But and it's a huge but, the huge problem is that the same policy document, literally in the same paragraph, that it says we want to end weight stigma, we want to reduce weight stigma among children and among teenagers to improve mental health. They're also saying that they want to reduce the level of obesity by X% by 2020 and blah, blah, blah. And why is that a problem? Well, you can't say in the same breath that you want fat bodies and fat children to feel accepted and feel needed by society, and at the same time say you want to get rid of fat bodies by 2030. Because that's completely, paradoxical. You can't think both of those things at the same time. So here is a call out. If you are working in public health, if you are working in government, anywhere in the world right now, why are our policy documents like this? There is so much evidence telling us that weight stigma is harmful for health, physiologically and psychologically. There is also a huge amount of evidence telling us that weight loss attempts do not work. Dieting behaviours do not work and are actually damaging to health. So why are we still encouraging weight loss as a way to improve health? Why aren't we changing the environment through our health policy to reduce weight stigma? And what will happen then is you will see weight stabilise across people. Because when people are, told to be dieting all the time, they're told they have to lose weight, they become preoccupied. We become absolutely obsessed with food. And if you've read or heard anything about the Minnesota study years ago, you will know this. It's very well documented, the effects of dieting. So why can't we change it? It seems like what we're doing with health policy is we're regurgitating the same policy every time, but all you've done this time is you've thrown in reduced weight stigma. But you haven't actually thought about how we're going to reduce weight stigma. And one of the ways we need to use to reduce weight stigma is stop using weight loss as the miracle cure for everything in health, because it isn't. Weight loss is not the big mecca in health policy. And all we've seemed to be doing in public health is just, promoting some kind of weight loss diet after weight loss diet after weight loss diet. And we've seen it a lot in the UK, and I've written about it a lot, about these anti-obesity campaigns by Cancer Research UK and by Public Health England. And it's the same campaign that we've seen time and time again, and it's having no effect. Same Change for Life. How many millions of pounds were spent on that? And did it actually affect the health of the population? No. Very little research to suggest it had any positive benefit at all. So why are we focusing on it? Why are we spending taxpayer money on something that is literally not going to work? We know it's not going to work. We know where it can be useful. And why are we not spending it there? I don't know.